Hi, I'm Kelly Davis, the owner of Skin Essentials Ledger Mescalon Salon, and I am personally super excited that you've decided to take the steps to live your best life by optimizing your hormone levels. Our team of nurses specialize in BHRT, which is Bio-identical Hormone Replacement, along with cosmetic injections and cosmetic procedures so that our patients and clients look and feel their best. We are here to help you every step of the way, so the next part of this video is going to show you what to expect on your first service, and it's also going to show you a little bit about the supplements that go along with hormone optimization to make sure that all of your levels are optimal. We look forward to serving you, and we look forward to partnering with you on you aging healthier and happier.
The purpose of this video is to give you a little bit of pre-information before your appointment, so you can go in there with many of your questions answered, and you and your practitioner can just focus on you and what your needs are. The first thing I want to say is congratulations, because you are about to make a huge step in regaining your life. So many patients come to us with the initial symptoms of depression and anxiety, irritability, mood swings, brain fog, very hard to focus, afternoon fatigue is hallmark, not being able to sleep at night. Women get night sweats, some men get night sweats. And the reason all of those symptoms happen is because of testosterone deficiency. And for you women watching, a lot of women don't even know that we make testosterone and we need it. The inner core of the female ovary makes testosterone and the outer core makes estrogen. And as women age, our ovaries age from the inside out. So we lose testosterone 10, 15, 20, and sometimes more years before menopause ever kicks in. So all those years in our 30s and 40s when we're depressed and moody and anxious and we can't focus, and we go to our doctors and we're given a myriad of prescriptions for antidepressants and sleeping pills and anxiety pills, that's really not the fix. Now for women that are menopausal or postmenopausal and going through that estrogen decline part of life, we call it hormone havoc, it's kind of crazy. It takes all of those symptoms of testosterone deficiency kind of to a next misery level, if you will. That's when hot flashes, which are a flushing that starts deep in the core and creeps up your neck and face, lasts about 30 seconds or more. That's a typical sign of estrogen deficiency hot flash. Some women get them, some women don't. Some women get 2 an hour, some women get 2 a minute. It's really variable and everyone is different in that symptom. As some other symptoms of estrogen deficiency are bladder and vaginal symptoms, incontinence, urgency, frequency, and so forth. These are all of the things that we are going to look at when you see your practitioner and get those things in balance. Some other things that we really hone in on, because it's so important not just to look at your estrogen and testosterone and progesterone if you're a female with a uterus and you haven't had a hysterectomy, is your thyroid optimization. So many women, especially postmenopausally, are suffering from what we call type 2 hypothyroidism or thyroid resistance. And that is where your thyroid numbers look in the normal range, but really you're very symptomatic for low thyroid. And some of those symptoms overlap low testosterone, such as energy, weight gain, cold hands, cold feet. These are all telltale signs. And as it gets lower and lower, hair thinning and eyebrow thinning and many other symptoms. We also look very closely at your vitamin D levels, because vitamin D, although it's called a vitamin, it really is a hormone. It looks and acts like a hormone in our bodies, and it plays a big role, and there's a lot of synergy between vitamin D, thyroid, and testosterone and estrogen. So all of those symptoms that brought you to your practitioner that I mentioned are really what we're going to be looking at from the hormone standpoint. But a couple of things I really want you to understand about balancing your hormones and testosterone specifically, some non-tangible benefits, if you will, those things that you can't touch and can't feel, are the many, many studies that show testosterone specifically to be highly breast cancer protective. Hundreds of studies show that testosterone decreases estrogen stimulation of breast tissue and therefore decreases our breast cancer risk. It's also a powerful bone builder. We have patients that have built up 8 to 10% of their bone density over the course of 1 to 2 years on testosterone pellet therapy. Alzheimer's disease risk reduction for women is 50%, men is up to 70%. So what we're finding is hormones in general, and specifically testosterone, plays a really key role not only in how we feel and how we look, but how we age and our long-term health benefits. some of the questions that you might have for your practitioner may surround your dosing, may surround potential side effects, may surround how long do I have to be on this therapy. So I'm going to address a couple of the most common questions that I hear in my practice. The first one is, how quick am I going to feel good? Well, the pellet implants take a little bit of time to start working. So most people say the first week, as their symptoms start to lift, the sleep is improved, hot flashes go away right away if you're having that problem. By the second week, the mental clarity, mental focus is coming back. And by the 3 to 4 weeks, when you're on your way kind of to the peak, that's when the energy surge, libido surge for women kicks in, and so forth. There could be some nuisance side effects of hair growing faster. You know, we have a lot of women that complain that they have to color their hair more often, or hair fuzz on their face may grow faster than it normally does. For patients that are out of balance with their estrogen and progesterone, for instance, if you are a postmenopausal woman that is going to receive estrogen and you don't take your progesterone properly, you can have side effects of bleeding. So there are some side effects. They're all manageable. There are no permanent side effects with this therapy. And again, really minimal side effects to none if it is dosed and done properly.
Hi, I'm Terry Denai, founder and national spokesperson for Avexius Health Solutions, and I want to talk to you today about some of our supplements, our nutraceuticals that we highly recommend our practitioners utilize in their hormone optimization therapy. Now, Avexapel is our hormone optimization method that utilizes hormone pellet therapy, but we also look at several other key factors of hormone optimization like methylation, metabolism, receptor site activity, and there are some key nutraceuticals that optimize hormones through those channels. The first nutraceutical I'm going to talk about today is B-complex. Now, a lot of people wonder, why B-complex? What is B-complex going to do for me as it has to do with hormone therapies? Well, very, very important part of hormone optimization is how we metabolize in the liver, especially estrogens. Now, when I talk about B-complex, I'm not just talking about patients that are coming in and getting hormone therapy. I'm talking about any form of estrogen that is in our body, whether it's from our own bodies making it, ovaries make it, it's made in peripheral fat, whether it's hormone therapies via pellet therapy, via an oral estradiol, or some other form of hormone therapies. Men and women both make estrogen. And it's so important when our bodies are making and utilizing estrogen that we metabolize it in favor of what we call the good estrogen. And a key part of that is methylation. So it's so important that your B-complex have not only all of the B vitamins, but a methylated form of B12 and methylfolate, and that just aids in the metabolism and the detoxification and the shift in the estrogen metabolites in favor of what we call the good estrogen, and so you can excrete what we call the bad estrogen. Now, the other thing that B-complex has in it that's really important are all kinds of great B vitamins that help with brain health, with mood, with memory, focus, mental clarity, and so forth. Sometimes we have patients come in and they're still having a lot of symptoms of hormone imbalance, and then we'll ask them, well, are you taking your B-complex? Oftentimes they say no. They start taking it, they see a huge difference. So. Next, I'm going to talk about DIM. DIM is short for diindolylmethane. Now, DIM is something that's found in cruciferous vegetables in abundance. It's a really important nutrient that helps us metabolize estrogen, again, getting that good estrogen. No matter our exposure to estrogen, whether it's through a hormone therapy or whether it's through the environment or whether our bodies are making it, it's really important that we favor the 2-hydroxyestrone pathway. That's the good estrogen. The bad estrogens are the 4 and the 16. We don't want those. We want those excreted out our GI tract, out of the system. The other thing that DIM does is it helps increase our free testosterone. testosterone. So there's a protein called sex hormone binding globulin, and it binds up free testosterone. But sex hormone binding globulin actually likes the bad estrogen better, but it needs DIM to help with that conversion. So when you take DIM every day, and for women that's about 150 to 300 milligrams, for men it's anywhere from 300 to 600 milligrams depending on your needs, what that does is it knocks free testosterone off sex hormone binding globulin and grabs up the bad estrogen. So you kind of get a double bang for your buck with DIM. Very protective to the prostate, very protective to the breast tissue in that regard, and just really gives patients that are on any kind of testosterone therapy or hormone optimization just that more bang for their buck. Make sure you're taking your DIM if you're on any hormone optimization. One last thing I need to say about DIM. Not any DIM will do. You can't just go into a nutrition shop or a vitamin shop and pick up DIM, because it has to be specially formulated in a micronized form. And that is very, very hard to find. Our DIM is a proprietary blend that is micronized DIM, very important for your hormone optimization regime. The next supplement I'm going to talk about is vitamin D, specifically in the form of ADK. Now, it's really important that all three of these be taken together. They balance each other out. Anytime you take a vitamin D supplement, which now is very common, everybody's really getting the message that vitamin D is very, very important. It raises calcium levels, and calcium is fortified in everything. We're way over calcified in this country because there's calcium in everything. Calcium is the main ingredient in concrete that hardens concrete. So all this extra calcium roaming around our bodies is not good, hardening arteries and all kinds of things we don't want hardened. But what vitamin ADK has in it is vitamin K2. Now this is different than vitamin K1 that's found in green leafy vegetables that has to do with clotting. That is not what this K is. This is vitamin K2 in the form of minoquinone 7. That's a very important analog of vitamin K2 that helps shuttle calcium into the bones or the teeth or excrete it out the kidneys, wherever it needs to go. So very important that your D supplement is combined with K. Now vitamin A balances out vitamin D, and another really important supplement to take along with your ADK is magnesium. Magnesium citrate, magnesium glycinate, any of those is really important also to help with calcium absorption, calcium metabolism. We just don't want to be overcalcified. We want that calcium to get out of our bodies or into the places where it belongs. The other thing about vitamin D is a lot of people think they're taking enough. And really an adult daily dose is a minimum of 5,000 IUs. Another thing that people misunderstand about vitamin D is their vitamin D levels. So many healthcare providers are testing vitamin D, and that's so important, but unfortunately the reference range for vitamin D is between 30 and 100. Now the reason that's the reference range is because we know anything under 30 increases the chance for rickets. You know, rickets has been eradicated in this country for decades and decades. But what we know now is vitamin D levels really need to be up above 60. In fact, 80 is optimal. We're all about optimal levels of hormones and vitamins and all of those things, not just enough in the reference range. Levels below 60 can hold a 5-fold increased cancer risk, 160% increased risk of heart attack, and when your vitamin D levels are low, in combination with low testosterone levels, your risk of all cause of death goes up 4-fold. So very important to get your vitamin D, but also that you have the companion nutrients of A, D, K, and magnesium. The next supplement that I'm going to talk about is iodine. Iodine is a very key mineral. We're actually multi-mineral deficient in this country. Oftentimes, you know, people are wanting to know, well, they always ask, what kind of vitamin supplement can I take? Well, it's really minerals that we need. I've already talked about a couple of minerals, but iodine is a really key one. And we're very low in iodine in this country, for actually worldwide, truthfully, for many, many reasons. One of the number one reasons is our soil soil is very demineralized. We're not growing our foods commercially in really good iodine-rich soils. The other thing that happened in the 70s is iodine was actually taken out of commercially prepared foods as a supplement enhancement. Fortified is the word I'm looking for. Iodine used to be fortified in baked goods, but now it's not. They actually have something in there called bromide, which is not really very good for us. We need iodine. It's very protective to all the glandular tissues, thyroid, prostate, ovaries, breast. Low iodine is highly linked to fibrocystic breast disease, breast cancer, but specifically thyroid and thyroid issues. Oftentimes we'll have patients come in to our offices, to any of our clinics, our Avexius Health Solutions providers that will have many symptoms of low thyroid, and oftentimes just supplementing with some iodine can really help with that. So iodine, very important to get. It's very difficult to test. The most accurate lab indicator is actually a 24-hour urine test. Very difficult to test for, but just suffice it to say the majority of our population is low in iodine. It is very difficult to get too much iodine. Symptoms, the number one symptom of iodine excess is a metallic taste on the tongue. Now, in a decade of recommending iodine in higher doses to my patients, I have never had a patient complain of that. We recommend 12.5 milligrams a day minimally to start, and sometimes some patients take up to 50 milligrams a day, depending on what it is that they're treating. So iodine, very important mineral to supplement with. Hi, the next supplement that I want to talk about is a probiotic. So many people take probiotics, but they don't realize how important a probiotic is actually for hormone balance and for brain health. There's a whole gut-brain connection that's a whole nother teaching segment, but suffice it to say that taking a daily probiotic, a good quality, broad spectrum probiotic is key for optimal health. Our gut microbiome plays a very, very important role in but excreting the hormone metabolites that we don't want reabsorbed in our body. So having excellent gut health is really key for hormone optimization. It is also key for immunity. The gut is the gateway to our immune system. Imperative for serotonin production. It happens in the gut. A lot of people think serotonin comes from the brain. It starts in the gut. So poor gut health can be related to ADHD, ADD, depression, anxiety, mood swings, irritability, all of the things that we hear in our clinics every single day, because those are all hormone deficiency symptoms as well. So the whole point with talking about many of the supplements that I've talked about, including a probiotic, is it's so important not to just put gas in the tank. So many people are just getting their hormones, they're getting pellet therapy, or they're getting shots, or they're getting some form of hormone, and they're not optimizing that and making sure their body has what it needs to metabolize and to excrete the bad metabolites. Gut health is key to that. So get yourself a very good probiotic.